Hi everybody, this is Traci Cornelius. Welcome to Pregnancy Week 30 Part 2 on the vlog. So last week we discussed a little bit more about the kind of embarrassing things that most people don't want to talk about. So especially hemorrhoids was a big part of the conversation. Now, I did also mention that I was personally going to go and see the doctor, which I have done. Turns out I need an operation, but due to the fact that I'm pregnant, they are not going to operate because obviously the anaesthetic can affect the baby. So that leaves me in quite a difficult situation. And I honestly wanted to cry when I kind of came out because I just know what's going to happen. So trying to mentally prepare myself for that is actually quite hard. And this will really then make me go back to what I said last week of like, as soon as you notice that you've got anything like that, do not suffer in silence. Go and see your doctor or midwife and try and get some advice and some help as soon as possible, because the longer that you leave it, the more difficult the situation and the more painful it can actually be. So yeah, and this is not something that, like I mentioned last week, is going to get better. Your baby is going to be growing, so there's going to be a lot more pressure being added, so it's just going to escalate and escalate and escalate. So the other part that, again, a lot of people don't really like to talk about, that you will more than likely find from this week, maybe even going forward, is actually increased discharge. Now, if this is your first pregnancy, it can also be a little bit alarming as to how much. The discharge can be anything, it's almost like a kind of jelly substance, and that's perfectly normal. It will happen to many pregnant women, and don't be surprised if it also happens after a bout of Braxton Hicks, or if you've had increased activity or sex or anything else like that. All of those type of things can bring on the addition of the discharge being released, for want of a better word. Now, the only times to really get help or to call your midwife are if you find that they are blood streaked, whether it's like from a pinky colour right the way through to a brown colour. You need to contact your midwife straight away. Also, if it tends to be, if there's like an offensive smell or anything else to it, because that's much more likely to indicate an infection rather than just the natural progression of the pregnancy and the discharge just coming away, that type of thing. Now, there is a big difference between losing your plug, which you will probably read a lot more about in the coming weeks closer to your due date. But just as a brief explanation, the plug is a mucus plug that basically seals the cervix, making sure that there aren't any infections or bacteria or any nasties kind of getting to your baby while you're pregnant. Before you have your baby, that usually dislodges. For some people, it doesn't happen until they're literally giving birth. But for the majority of people, it will happen beforehand. And sometimes it can even happen weeks beforehand. It's not always the first indication that you're suddenly going to massively go into labour. So if it does happen, do not panic. You kind of have time. Now, the other part to mention about the mucus plug is it doesn't always necessarily come away in one. You may find that it will come away over a period of a few days, right the way through to like maybe a week or so. Again, that would be quite normal, so again, don't kind of panic. It does tend to be quite a large quantity, so if only a small amount has come away, yes, do mention it to your midwife, but just be prepared that there's probably more to come. So that's just like a brief explanation, because that will come a lot later on. Probably we'll discuss that a lot more between week 37 and about week 40. But the discharge is something that is quite normal. At the moment I'm wearing a pad, which Grace quite happily described as a nappy the other day. Like, oh, you're wearing a nappy. Which amused me immensely. Probably because she's not used to going to seeing it, I guess. But you might find that that's a little bit more comfortable, and especially if you're out and about, it means that you don't have to worry quite as much, because there's no warning sign, there's no feeling that you get beforehand to give you an indication. You know, it just happens. So it's better to be safe than sorry. Also mentioned last week that for many people, around about this stage is when you can start leaking colostrum. So again, to make sure that if that's the case, to have breast pads on hand. Now, other parts that can also happen that many people don't tend to talk about on a regular basis is things like varicose veins. Your baby at this stage is getting a lot heavier. They're putting on quite a lot of weight in consideration to where they've been to now. Everything up until now, it's been all about development and like making sure that the internal organs develop and, you know, build and all the rest of it. From now, everything is already in place. It's just a case of everything getting bigger, heavier, fat storage going on. So heaviness tends to occur. That heaviness puts a lot more pressure onto the body. The extra heaviness will mean that you can experience things like varicose veins, and again, that's quite common. You can also experience shortness of breath. That would be one of the type of things that would definitely increase from this week onwards. That's where the baby is pressing, because they're getting a lot bigger. There's a lot more pressure going on the lungs. There's a lot less room in there, all of those type of things. Plus there's a lot more blood pumping around your body, putting extra pressure on. So you might find that even a conversation will make you a little bit more out of breath. Walking up the stairs feels like you're walking a marathon, basically. So again, completely and utterly normal. Sleep patterns can be disrupted due to frequent urination, cramp, getting uncomfortable, trying to find a good position to be able to sleep in, especially if you're experiencing your baby back to back, which basically means that their back is against your back. That can put a lot of pressure onto the spine and also the lower part of your back. Also, to be honest, especially if this is your first pregnancy, your bust can be very sore. So even trying to sleep and making sure that that is comfortable can also be quite difficult. Pigmentation. I haven't mentioned that. You can also get darker pigmentation on different parts of your body. That's also a hormonal effect. It will stop after pregnancy. It will go back to normal, but if you do get that, again, that can be quite normal. Sorry, the phone is not doing very well today. So yeah, so those are the kind of extra parts. The only other thing that I haven't actually mentioned up until now that you may experience, and it does happen for a number of people, is that if you wear glasses or contact lenses, you can often find that your prescription will change. Your eyesight does do very strange things when you're pregnant. Personally, I cannot wear contact lenses when I am pregnant. My eyes seem to dry out and get irritated a lot more easily while I'm pregnant than when I'm not, for example. Oh, one other part to mention is also when you're brushing your teeth, bleeding gums. Doesn't necessarily mean at this stage that you've got gum disease, although I would definitely recommend getting it checked out. But again, it tends to be a hormonal part, so every time you brush your teeth you may find that your gums do tend to bleed, and that happens to a lot of pregnant women. Really, that's kind of it for now. You may notice we're week 30 now, so you may start to notice a lot more swelling. That would be especially in hands and in feet. So if you wear a ring, you'll notice that sometimes I'm wearing my ring, sometimes I'm not. That will also depend on the swelling that I happen to be going through. At this time of year, obviously in the UK, it's quite, I was going to say cold, but actually it's quite warm at the moment. But in summer, or if you live in a hotter climate, that can obviously get a lot worse. Drinking water on a regular basis can actually help with that. I know it seems a little bit backwards, but the more water you drink, the less water retention you seem to hold. And keeping hydrated is obviously extremely important. Any other things that I need to... Oh, extra hair. That's one of the other anomalies that you will have in pregnancy. Is that you can have hair growing in places that you didn't really originally have hair growing on. So like around the belly button, for example. Sometimes it can be for people in the face, all of those type of things. Again, can be a natural part of pregnancy. It's all down to hormones. If you're concerned about anything, then get in contact with your midwife, and I'm pretty sure that they would be happy to go through with that. I think really for about week 30 that about it. So I will catch up with you guys next week. If you haven't seen part 1, which is the more softer approach as to all the different symptoms happening from this week, then do check it out. The link will be at the bottom of the box. And as usual, my blog will hold a number of different external links to more information so that you can find out the figures and the facts and all of that type of thing as well. Okay then guys, thanks very much for listening. Take care. I'll speak to you soon. Bye.